Hi, and welcome to today's training program. Today we will be talking about bloodborne pathogens. Our objective today is to define what bloodborne pathogens are, identify the risks of exposure that we would have here at work, to talk about methods to protect ourselves against any exposure, and what do we do if someone potentially does become exposed to a bloodborne pathogen. First, let's define what a bloodborne pathogen is. It is a microorganism that can be present in human blood or other body fluid that can lead to and cause diseases. There is a term frequently used in bloodborne pathogen training. It is universal precautions. It is an all-encompassing term that addresses the seriousness of the risks associated with bloodborne pathogens. Quite simply, it means we treat all potentially infectious materials, such as blood and other bodily fluids, as if it is contaminated with a bloodborne pathogen. Treating all body fluids in this manner should convey the seriousness and the care that needs to be taken when dealing with any body fluid. Although it is quite rare, it is possible to become infected with a bloodborne pathogen. Becoming educated about the risks and how to properly respond to an incident will help keep all of us safe. This list identifies some of the more common diseases that bloodborne pathogens can cause. New strains and variations, as well as new pathogens, are always possible, and new diseases may be added to this list. In the course of my lifetime, there has been the discovery of 3 new bloodborne pathogen diseases: HIV, Ebola, and Zika. Each of these pose a threat to society, and they need to be taken seriously just as any other bloodborne pathogen. Next, we're going to view an informative video that discusses more about bloodborne pathogen and the diseases that they cause.
So you might be asking yourself, how are bloodborne pathogens and infectious diseases spread? Well, first let's look at what a bloodborne pathogen is. It's a microorganism, such as a virus, that are present in human blood and can cause disease in humans. These pathogens include, but aren't limited to, hepatitis B, hepatitis C, and human immunodeficiency virus, otherwise known as HIV. Infectious disease is a disease that enters into the body through various routes that is caused by microorganisms such as bacteria, fungus, or a virus. And infectious diseases can range from mild to even life-threatening. For disease to be spread, it requires several conditions to be present that we call the chain of infection. There must be an adequate number of pathogens or disease-causing organisms. There should be a reservoir or a source that allows the pathogen to survive and multiply. In other words, blood itself. A mode of transmission from the source to the host, an entrance then through which the pathogen may enter the host, and lastly, the host has to be susceptible. In other words, they don't have an immunity to that virus or bacteria. Infection control strategies serve to prevent disease transmission by interrupting one or more links in that chain of infection. The primary source of potential bloodborne pathogens is blood and specific body fluids, like semen and vaginal secretions. Other bodily fluids may contain bloodborne pathogens, especially those visibly contaminated with blood, such as cerebrospinal fluid, which is usually found around the brain, synovial fluid, most often found around joints, pleural fluid, which lines the lungs, amniotic fluid that is in the uterus, pericardial fluid, which is around the heart, and peritoneal fluid, which is around the abdomen. Urine, feces, saliva, and some other body fluids do not typically carry bloodborne pathogens, but when introduced with blood, also become potentially infectious materials. However, it can be difficult to identify a body fluid or know for sure whether or not it is contaminated with blood. And in general, you should treat all body fluids as potentially contaminated with blood with the potential for carrying a bloodborne pathogens disease. So if we could be sure that we could always keep the bloodborne pathogen outside of our body, we really would never have to worry about this. But unfortunately, there's many routes that do introduce that disease into us. And the 4 basic modes are what we're going to discuss now. The first one is direct contact. This occurs when microorganisms are transferred from one infected person directly into another person. Examples of this would include a caregiver who has an open, uncovered wound and blood from a patient contacts the caregiver's wound. Parenteral exposure is this that comes in infected blood and then is introduced directly into your body through like a piercing wound, like maybe a needle stick or some type of sharp, jagged glass that has blood on it or metal and then jabs into your body. Indirect contact involves the transfer of an infectious agent through a contaminated object or person. An example would be a caregiver that doesn't wash his hands in between caring for someone with infected body fluids and other patients. Or a person picks up a blood-covered material with his bare hands while cleaning. And then airborne transmission, which occurs when droplets or small particles that contain an infectious agent then remain effective over time and distance in the air, like tuberculosis, for instance. That's a very common disease that's spread this way. Bloodborne pathogens are not typically spread in this manner. You might be wondering what the most common way that bloodborne pathogens are spread. And it's most commonly spread through sexual contact. That's the primary mode of transmission for bloodborne pathogens. The highest potential risk while providing medical or first aid care exists when a contaminated sharp object cuts or punctures the skin. A parenteral exposure is what that's called. Now, examples would include like a needle stick, injection from drug usage, a cut from broken glass or metal, or human bites. A medium potential risk exists when an infected body fluid gets into an open cut or a mucous membrane, such as in the eyes, mouths, ears, or nose. The lowest potential risk is when a contaminated object touches inflamed skin, like acne or skin abrasions. In addition to knowing how bloodborne pathogens are spread, it's just as important to know how bloodborne pathogens are not spread. Intact skin is our first line of defense against disease, and bloodborne pathogens cannot soak through normal intact skin. The Centers for Disease Control, or the CDC, states that there is no known risk from exposure to intact skin. Unlike some infectious diseases, bloodborne pathogens are not spread by casual contact, such as handshaking, hugging, doorknobs, or using the same equipment, like toilets or water fountains.
In our work environment, I view our risk of an infection to be really quite low. However, that does not mean that the risk is fully eliminated. For a bloodborne pathogen to be spread, the bodily fluids of one infected person must enter into the bloodstream of another person. In our workplace, if we were to have a transmission of an infection, it would most likely be through an employee's damaged skin, such as a not yet fully healed previous injury or some other skin condition. In light of what we deem would be our local risk for a bloodborne infection, here are some ways that we could come in contact with another individual's contaminated blood. Being scratched or cut while assisting or administering first aid to others, cleaning up after an accident and cutting or puncturing yourself with a contaminated object, such as broken glass, sharp metal edges, or a jagged tool. Working in close proximity with another individual who injures themselves and their blood comes in contact with your body. And let's not overlook the other activities in your life. Your interaction with others at the beach, on the mountain, out hunting, in a store, cooking, playing sports, or stopping to help when you see an accident along the highway. Activities such as these also put yourself at risk of a bloodborne infection. Although this program is a work safety program, the things you learn today can be used to help keep you and your family safe, regardless of the activity you're engaged in. Here are some common workplace examples where an employee may become injured and therefore pose an exposure risk to others. Cutting using a box knife or deli knife, slips and falls against a sharp object or edge. This could be in a liquid containment or off of a ladder. Use of hand and power tools in our shops, such as a drill or a saw. Vehicle accidents. Working in and around augers and transferring equipment. Sharp edges on office fixtures, like a filing cabinet. Improper sharps disposal of medical supplies, like a syringe, that could be found in our restrooms or in the trash. We have a plan in place to help educate and train our employees in ways to protect themselves against the risk of bloodborne pathogen exposures. This plan is part of our overall workplace safety program, and it can be found in each of our departments where the safety binders are kept. For your reference, this program is binder number 10. This written program contains these topics: education, where we learn and define what a bloodborne pathogen is, the potential risks that we have in our workplace, the PPE that is required, the proper procedures and precautions that must be followed in any incident. They also include instructions for cleanup, sanitizing, disposal, reporting requirements, and if medical attention is needed, how we go about that. Let's talk about the components of our plan in more detail. Education. The first line of defense is understanding what a bloodborne pathogen is, the diseases they can cause, how these pathogens can be transmitted, and how to protect yourself against the risk of exposure. This training today helps meet this education objective. Our plan identifies the correct PPE that is required. We will discuss this more in a minute. Minimizing and containing the risk of exposure are actions we can take to further prevent the spreading to other individuals. This can be done by doing simple things such as locking a door, quartering off a plant, warehouse, or shop, or applying floor dry or paper towels over a pool of blood or any other body fluid. In short, any action to prevent others encountering the body fluid is the goal. We will talk about the components of sanitation, handling contaminated materials, and disposal in a minute. Thoroughly washing with soap and water is necessary at any time we encounter a potential risk, even when we use PPE. Reporting any bloodborne pathogen risk or exposure to your supervisor is required. It allows for more trained people to be involved in the process and ensures the right steps are being taken. All exposure incidents need to be documented. The minimal required PPE are gloves, a gown or apron, eye protection, and a mask or face shield. These items are contained in a kit that can be found in each of our first aid cabinets. The items in the kit are the minimal required protection. They will work fine in minor incidents. Luckily, this is the only kind we've had to respond to. But let's be smart here. We have access to much better quality PPE. In fact, we use it all the time in our workplace. In the event of a more serious or severe incident, let's step it up and use our better PPE, particularly while we're cleaning, sanitizing, and disposing of any contaminated material. As essential as PPE is in guarding against a bloodborne pathogen, doffing PPE can also become a risk of exposure if it is not done properly. The term doffing is the term used for removing PPE. Take particular care when removing PPE that you do not contaminate yourself by contacting the outside surface of the PPE. Remove all PPE by rolling or tucking the outer surfaces inside of itself. This process will keep the contaminated surface from coming in contact with your body. For any cleanup task, be sure to use the appropriate PPE. When I say appropriate, I mean use common sense. Wiping a counter and throwing away a Band-Aid wrapper do not require the same level of PPE as cleaning up blood splatter on tools, broken glass, or pools of blood on the floor. A solution of water and bleach are effective to disinfect and sanitize work surfaces, tools, and equipment. Use paper towels and plenty of solution to thoroughly clean all items. Some items, like clothing and rags, cannot be sanitized in this process. Bag them and label them separately for proper laundering. That is, if we want to keep them. All other contaminated materials that cannot be cleaned, including used first aid supplies, cleaning supplies, and PPE, will need to be disposed of in a puncture-resistant bag or container. They must be labeled as a biohazard and disposed of at an authorized facility. We need to take great care with any object with sharp edges like broken glass or sharp edges of metal because they could easily cut through PPE or a disposal bag. Where possible, include enclose or wrap these items to prevent injury during the cleanup and disposal processes. If you should be exposed to any body fluid, we need to act quickly. Immediately wash all exposed areas with soap and water. Include any skin areas with a rash or broken skin. These areas are more susceptible to bloodborne pathogen entry. If necessary, be sure to flush your face, nose, mouth, and eyes. Report the exposure to your supervisor and seek medical attention immediately. A medical professional will best know how to treat any exposure. But remember, any effective treatment is time sensitive, meaning the longer you wait to see a doctor, the less effective the treatment will be. Today, we have discussed our bloodborne pathogen program. We've defined what a bloodborne pathogen is. We've identified the potential workplace risks of exposure. We've talked about how to protect ourselves, and we have discussed what to do in the event of a bloodborne pathogen exposure. If after this training you have any questions or would like further information, please talk to your supervisor or contact me, and we will get the information you need to keep you safe. Thank you for your time today.